Welcome to this presentation of the Michigan Challenge Program. This program is available to employers in the state of Michigan through the Michigan Occupational Safety and Health Administration, otherwise known as MIOSHA. MIOSHA is an agency under the Michigan Department of Labor and Economic Opportunity. The Michigan Challenge Program is administered through the Consultation, Education, and Training Division of MIOSHA. Today our presenters are Chris Johnson, Senior Safety Consultant in General Industry, and Deb Zeal, Senior Safety Consultant in General Industry. The objective of this presentation is to promote the Michigan Challenge Program. We have designed this program as a solution to assist employers in high-hazard workplaces. We will work with your management to transform your business into a proactive environment with a focus on safety and health and reducing hazards. Now let's step back for a moment and take a look at why businesses are there. Why are you in business? And maybe you're not the business owner, maybe you're a part of management and you make some of these decisions when it comes to safety, but let's look at why the business is in existence. Is it because of innovation? Is it because your company strives to do things better than the competition? Maybe you have a special skill set that you can provide for the general public. Maybe you have an ability to provide a service that's better than your competition. Maybe you're looking to create jobs for your area. You're looking to make your ideas happen and see them come to life. Maybe it's financial. Maybe you just want to make money. Maybe you want to accumulate that wealth. You want to be able to sell off your business someday at a big profit and enjoy all the work you put into it. Maybe there's some tax benefits. Maybe you're trying to raise money for a certain cause. Maybe you're a nonprofit and you have a passion for helping people out and serving people. Maybe it's strictly you just want independence. You want to be your own boss. You want to find the freedoms of working a business its own way, being in charge of a business and running it the way you feel it's right. Maybe it's a source of pride. Maybe you just feel that you have the ability to provide something and you want to see it happen. All these are good reasons to be in business, but safety is a big part of why businesses can succeed, and it's also a way that businesses can fail. And when we look into this program further, we're going to see how being safe can actually save your company money. One of the things that can prevent you from reaching your goals in business is the amount of money that employers spend on injury and illnesses in the workplace. Liberty Mutual did a study back in 2020, which is based off the 2019 Bureau of Labor Statistics of Workplace Injuries and Accidents. And as you can see here on the chart, the total cost of most disabling injuries is almost $60 billion. And when we look at the top 5 causes of those injuries, it makes about $41 billion, or about 70% of the total burdens. And so when we look at the next slide, we're going to break it down and what are those top 5 causes and what are the biggest issues out there that are causing employers to lose money to injury and illnesses. The top 5 costs are listed on the bottom of this chart, and we'll go through them one by one. The first one here is other exertions or bodily reactions. This is when you're pulling on something and it lets loose and you hit your elbow on something, you bump your knee on something. Another exertion on a force or something causes you to react to something. That's $4.69 billion. The next one is falls to a lower level. This is very common in the construction industry, people working on rooftops, working on ladders, is when they fall to a distance. And that's $5.71 billion. Next one, as we go down the list here, at $6.12 billion is being struck by objects or equipment. This could be being backed into by a fork truck or a piece of equipment that's moving in the facility and the employees at a spot where they are exposed to that hazard. Next one down here is fall to the same level. This is over $10 billion. We had fatalities here in Michigan where people are walking along a work surface and they trip on a cord or they trip on some packing material and they fall. They end up hitting their head on something, or they have internal damage such as a laceration of a liver, which we had a couple years ago here in Michigan, where it went undiagnosed and a few days later ended up taking that employee's life. So falls to a lower level are a big issue, but again, falls on the same level are actually a bigger issue. And here in Michigan, we're no strangers to the issues that we have with seasonal problems. Ice and snow and sleet are big issues here for about half the year. And these are some major issues. And again, these are other things that people have fatalities with and other serious injuries here in the state when they're walking on ice or they don't realize that it's slippery. They hit their head and they have internal bleeding, and it becomes a major issue and a major expense for employers as well. The final one we have here is overexertion and handling objects. And this could be picking up material, this could be moving patients around. This is extremely prevalent when we're talking about nursing homes and medical facilities. When people, specifically nurses, are moving patients around or walking with patients and they are adjusting these patients and sliding them around on their beds, these cause a lot of strains and sprains. So employees, as they're falling, they grab onto the next person, which is quite often a nurse, and pull them down with them. And these cost hospitals and other medical facilities billions of dollars a year. And if we kind of think about overexertion, one of the biggest ones we have are back injuries. And I'm sure if we look into our own network of friends and family, we know people that have bad backs. And 99% of the time, those bad backs never get back to 100%. Those people continue to have issues, and these are life-changing problems that people are experiencing, where they can't go swimming, they can't pick up their grandkids anymore, they can't play the sports that they enjoy, they can't go hunting, they can't do the things that so many of us take for granted. And so again, not only are they expensive for the employer at almost $14 billion, they're also a big adjustment for these employees when it comes to their personal lives. When it comes to incident costs, we like to use the analogy of an iceberg and the difference between direct cost and indirect cost. And direct costs are those fees that you see very easily, they're very readily available to you. Then you got the indirect cost, one that's a little bit more tricky to put a dollar amount to. And just like an iceberg, you see the 10%, the direct costs. Those are the things that stand out to you. But what you don't see are the huge amount of potential costs that are hidden below the surface. And those are the things that it's really kind of hard to narrow down sometimes, but when you add it all up, it can be a significant amount of money. Let's look at these costs a little bit further. Let's start off with direct costs. Again, this is the most identifiable cost when it comes to employee injuries. Start off with medical costs. Those are going to be the bills that you get from the doctor or from the occupational health clinic, physical therapist, whatever that place might be that the employee went to get medical treatment. You got indemnity payments. Those are those fees that you get when you can't deliver a project on time or a piece of equipment is later than it was scheduled. Quite often these contracts, there's a fee that the manufacturer must pay if they can't deliver at the predetermined time. Insurance premiums, your workers' comp premiums, any other type of insurance premiums you may have to pay for your employees, those can increase. If your mod rates go up because your employees are getting hurt more than your industry average, your premiums are going to increase as well. And on the opposite side of that, when employee injuries drop, they're not paying as much, your mod rate decreases, and in turn, your insurance premiums should decrease. In employee compensation, those are those other fees that might come into play when an employee gets hurt, whether you have to make some accommodations for them or other things you may have to pay for that employee to help get them back to normal. Now let's look at some of the indirect costs. Those are going to be those costs that are really kind of tricky to maybe put a dollar amount on. And the first one here is time lost by workers and management. If an employee gets hurt and they have to go to the clinic, to the doctor, to the emergency room, that person obviously can't work. And if another employee has to drive them, that person can't work. And now let's also think about if there's an investigation. Those employees doing that workplace injury investigation are going to have to spend time. That might be HR, might be plant management, that have to dedicate time to investigating that when they could be doing other things. Maybe it's the supervisors as they're filling out the workplace injury report. Again, supervisors are very busy. They have a lot of things they can be doing, and we usually don't schedule time in their calendars to be filling out paperwork for employee injuries. Could be schedule delays, which can set a company back because you may have to have your employees work overtime to make up that lost time as employees are injured and they can't work. We know that quite often our employees right now in this climate are working overtime as it is already because it's hard for us to find new workers. And that kind of brings us to the next one, loss of job experience. If you have employees that have been around for a long time, they know how to do a lot of the processes in your facility, and you lose one of those employees to workplace injury, whether it be temporary or for an extended period of time, that experience is valuable, and that's very hard to replace, especially if it's a person that maybe they are the only ones that know how to work a certain machine or process. If you lose them, it's going to be very hard to replace that person. Pain and suffering. Again, it's very hard to put a cost on pain and suffering, but no one goes to work to get hurt. And we don't want to see our employees get hurt. We don't want to see them suffer. We don't want to see them not be able to provide for their families as well. Training replacement workers. It takes time for employees to get up to speed. It takes time to train them. It takes time to interview new employees. It takes time to transfer them to new work environments where they're learning new processes and new procedures. So there's a delay. There's a fact that they're probably going to be a little bit slower getting up to speed than some person that's already been working there for an extended amount of time. Administrative time. Time that your HR has to file workers' comp reports, employee injury reports, possibly reporting stuff to MIOSHA and dealing with a MIOSHA investigation for the employee injury. Loss of production. This can be for that person that gets hurt, but it can also be for other people that witness it, because we realize that sometimes employee injuries are very intense and very traumatic for other people that might be around. I know my personal experience, I dealt with a company that had a person have a seizure, and all the people that saw it happen, most of them never seen a seizure before. A lot of them got really scared, and they actually had to shut down that department for a day. They had to counsel some of those people, let them know that that employee was going to be okay, because they were scared, they were afraid, they were sad. There was a lot of feelings going on there. So that company lost quite a bit of production that day because of an employee injury. Cleanup time. We know sometimes that employees get hurt and they may bleed out, and there might be areas of blood that now that maintenance or facilities needs to take time to clean and disinfect any area that employee may have touched with any type of bodily fluid. Loss of contracts. When big events happen, whether it be a fatality or major injuries to employees, that can make a difference to the general public's view of that company. And sometimes we've had it here in Michigan, where a company will they will lose their contract because they've had a major incident at their facility that got publicized, and big clients don't want to do business with companies that hurt their employees. Equipment repair, for when equipment gets damaged and during the injury. Legal fees. Sometimes employees that get hurt will go find legal counsel, and they will try to get a lawsuit against an employer for having unsafe working conditions. And if that would happen to your facility, then you also will need to get legal representation, and that can get pretty expensive. Workers' comp increases, because we can see those when those mod rates increase, that workers' comp premiums can increase as well. First aid supplies, something that a lot of places overlook, but if people are constantly cutting their fingers, getting things in their eye, getting slivers, they're going to go to your first aid cabinets and they're going to use the first aid supplies in there. And those first aid supplies can really add up after a while. Bad publicity, reputation. If your facility is known as being an unsafe place, whether you've been in the news for issues, you've had several MIOSHA citations, or just frankly people in your city and community talk about what an unsafe place it is, or they knew someone that worked there that got seriously hurt, that can make it a challenge to hire quality people. Negative effect on employee morale. Employees like to feel that they're important, that they're being taken care of, that the employer has the employee's best interest in mind. And if you have a workplace where people are getting hurt, you're not doing anything to stop it, to prevent it, to be proactive about any of those safety issues, employees are going to realize that. They're going to feel it, and that's going to have an impact on how they work for that employer. Potential counseling for employees that do get hurt or seeing someone get hurt, that can be pretty expensive because we know this post-traumatic stress disorders can happen in workplace injuries. And this can be an expense that employers may have to pay for. And finally, we have fines, whether that be a MIOSHA penalty for citation or EGLE, what's good informally was a DEQ. You have different organizations that have jurisdiction over your facility, and if you are having unsafe conditions or you are releasing toxic gases, toxic chemicals, you have the potential to be paying large fines to government entities for those. And this is where the Michigan Challenge program comes into play. It's a program for employers who have a total case incident rate, which is also called a TCIR, above the industry average and a need for developing or improving their safety and health program. The Michigan Challenge program consists of an assessment and evaluation of the employer's safety and health programs, including a review of their injury and illness data, written policy and programs, and an accident cost estimation analysis and reports, as well as hazard surveys and training. The eligibility requirements to participate in the Michigan Challenge program are for establishments of any size in which your North American Industrial Classification System, or NAICS code, are identified in the current MIOSHA strategic plan. Those include facilities that are wood product manufacturers, primary metal manufacturers, fabricated metal manufacturers, machinery manufacturers, transportation equipment manufacturers, support activities for transportation, hospitals, nursing and residential care facilities as well. They're for employers who are high hazard industries and or they have above average injury and illness rates. There are some exceptions. They are also granted for companies that are newly established. They're also for companies that recently reorganized with new management or supervision and they do not have an effective safety and health program in place, or for companies that may have installed new equipment or processes. One of the goals of the Michigan Challenge program is to limit the cost of injury and illnesses to your business. We also try to build a culture of work that will positively impact your profit margin. One of the tools that's available is the OSHA Safety Pays program. This is a website on Federal OSHA's webpage which uses your company's profit margin, the average cost of an injury and illness, and an indirect cost multiplier to project the amount of sales and services and or revenue a company would need to generate in order to cover the cost of those injuries. It's intended as a tool to raise awareness of how occupational injuries and illnesses can impact a company's profitability, not to provide a detailed analysis or of a particular company's occupational injury cost. We can introduce this tool to you through the Michigan Challenge program. Your consultation consultant will be able to help you identify those workplace hazards and develop and implement an effective injury and illness prevention program to overcome these challenges. In the next slide, we will demonstrate how this tool works. This is the OSHA Safety Pays program website, and this is basically what will show us how the estimation process works and what they figure for a lost time recordable injury and illness would cost your average employer. How you figure this out is you go to the direct cost, and so you have two different options here. You can either select what type of injury you want, or you can put in the information manually based on your workers' compensation cost. But for an example, we'll just put fracture in here. We will click on Add Calculate, and it adds our estimated total cost. And you can see, so we've got a fracture, direct cost that figures $54,000, indirect cost is $60,000 with a total cost of $115,000. And based on our 3% profit margin, which we put in here, we will need an additional $3.8 million of profit or of product sales in order to make up for that one injury. And some of these estimates include indirect costs such as wages paid to injured workers for absences that are not covered under workers' compensation, wage costs related to time lost through work stoppage due to the injury, any overtime costs that might be necessary, the administrative time spent by the supervisor, safety managers, HR, to do that type of paperwork, Any training costs for replacement workers, lost productivity, new employee learning curves, accommodation of the injured employee, and any cleanup, repair, replacement cost. Things not included are any type of MIOSHA fines or legal action, any third-party liability, worker pain and suffering, and loss of goodwill from bad publicity. And all these numbers come from the National Council on Compensation Insurance. So these are averages. These aren't meant to be exact numbers, but the idea is to give you an idea of what these injuries and illnesses are costing companies. We can put a sprain in there, see what that's going to cost. So that's going to be an additional $64,000 in expenses, bringing our grand total of sales necessary to cover those two injuries almost up to $6 million. So at a 3% profit margin, you can really tell how injuries can affect the bottom line. The Michigan Challenge program will help you develop a roadmap to get your occupational safety and health program in place. We'll help you try to anticipate and mitigate any safety and health incidents before they happen by training you on hazard recognition and also reviewing necessary programs that may be required for your workplace. A good way to look at this is think about, do you have a lockout tagout program, power industrial truck program, respiratory protection program? What about permit required confined spaces? Do you have any of these type of spaces in your facility? And if so, do you have a proper program that keeps your employees safe in the event that they have to enter one of these permit required confined spaces? These are the types of questions that we ask, we review with you, and we inspect your facility to try to find answers to. If you don't have a program in place, we can help you develop a program that's going to keep your employees safe and keep you compliant when it comes to MIOSHA requirements. Our goal is to develop strengths towards high employee safety and health accomplishments by getting your employees involved in safety. Also getting your leadership to walk the walk and talk the talk when it comes to the requirements of a proper safety and health management program.
There are 5 stages of the Michigan Challenge program designed to help employers develop an effective safety and health system. The program is designed to teach employers strategies to identify and mitigate hazards in the workplace prior to any human or property damage. In Stage 1, interested employers will be required to complete and submit the Michigan Challenge Program application package, which will consist of the completed MCP application form, the 2 most recent years of your injury and illness data, and your signed commitment statement. The application to enter the program is not terribly long or complicated. It consists of 8 sections. Sections 1 through 5 ask for the date of your application, your tax ID and NAICS information, logistical information about your facility, point of contact information, collective bargaining representative information, if applicable, and how many full-time and/or contract employees you have. In Section 6, we will provide your last 2 years of injury and illness rate information, which you can find on your 300A summary form. The Michigan Challenge program is designed for organizations that have higher than average injury and illness rates. But if you are at or below average, that does not necessarily disqualify you from the program, which is why there is the optional Section 7. Section 7 is optional. You do not have to qualify for the Michigan Challenge program because of higher than average injury and illness rates. We do have some exceptions, but we will need you to provide a brief explanation. The exceptions that may be considered are 1. You have a newly established company. 2. You have installed new equipment or processes that will affect the safety and health system. 3. You have a change in your management staff, and there is a need for assistance with developing or modifying your current safety program. And last, Section 8. We will ask for the signature from your organization's representative. Along with the application, MIOSHA will need a signed commitment statement from the highest ranking executive within your organization. The commitment statement states the following. We understand that the Michigan Challenge program offers us the opportunity to develop an effective occupational safety and health management program during a 3-year commitment with MIOSHA. We understand that the program is a free consultation service that will help us in the following ways: identifying the strengths and weaknesses of our existing safety and health program, learning about the elements of a strong safety and health program, learning about the fundamentals of effective management leadership for a safe work environment, learning of effective hazard prevention and control methodologies, receiving ongoing safety and health training for all levels of our organization, and learning about accident trends and cost estimates of our industry. Our commitment and continued involvement in the program will also benefit our business in the following ways: lower turnover rates and higher productivity, increase efficiencies in operations and product quality, decrease scrap and increase financial reward, improve product quality and positive brand image, decrease healthcare costs, increase morale of employees, reduce absenteeism, development of a solid and proven safety and health program, lower workers' compensation costs due to fewer employees' injuries and illnesses, reduction or elimination of property damage due to fewer incidents, deferral of 6 months from program inspections. Most importantly, we understand that our employees are our greatest assets and that their safety and health are central to our vision and mission. We are committed to providing a safe and healthful workplace to each worker. We have resolved to maintain sustained involvement and to work cooperatively and proactively with you to benefit fully from this extraordinary opportunity. Once we receive the application and commitment statement, we will send you an acknowledgement of the receipt of your application. We will complete an entity check, and we will inform the applicant of the decision. In Stage 2, a consultant will be assigned and they will receive a copy of your application. A consultant will then do an assessment of your existing safety and health programs and policies. They will perform an initial baseline hazard survey. This is a walkthrough of your facility to identify hazards for correction. An initial baseline injury and illness analysis and a cost estimation audit will be conducted. And last, your consultant will work with you to design and to develop measurable objectives and training programs to meet the MCP requirements. As mentioned in the previous slide, during Stage 2 of the MCP program, a hazard survey will be conducted. It is not uncommon for your consultant to find violations within your facility. They will generate a report that will identify the hazards, such as the picture shown here, of an unguarded and unsecured bench grinder. They will identify the rules that were violated and also provide you abatement recommendations. Barrington Carr, the MCP coordinator for the MIOSHA Sept division, is quoted as saying, "Achieving acceptable workplace safety standards must include a discussion of what, in fact, is a determined reason business operates." In other words, ask yourself if the safety of your employees is a factor in daily management decisions. If you want them to be, the MCP will help you incorporate safety into an active part of how you operate every day. Stage 3 of the MCP program is the implementation stage. During this stage, the participants will begin to complete and implement the policies and programs designed and developed in Stage 2. Participants will continue to enhance and develop safety and health programs. Participants will implement lessons taught so far and work on improving their safety and health programs. Core elements of the safety and health program are going to be taught. We will also conduct assessments to evaluate whether the training is effective, what is working, how well the information is being retained, how well the training is being received, and how the training is being put into practice. The assessment might include dialogues, observations, discussions, questionnaires, open-ended or otherwise, and other assessment tools that your consultant may deem appropriate. In Stage 4, this is the monitoring and participant self-evaluation stage. We recognize that to achieve success, it is important for you to maintain sustained involvement and demonstrate corporate or personal initiative in the Michigan Challenge program. Therefore, we require that the participant work cooperatively and proactively with the Sept division representatives to demonstrate a level of commitment to achieve their safety and health goals in the workplace. The participant shall be given time to implement the learning objectives taught in the instructional training period by using the tools and information provided to see a significant reduction in the participant's occupational injury and illness rates. This period shall last for 12 months following the completion of Stage 3 of the program. For clarity, Stage 4 of the program shall begin 24 months after the date of the MCP letter approval of application and shall end on or about 12 months thereafter. Participants will also perform and submit a self-evaluation to their Sept consultant 6 months into this stage. A participant safety and health program's self-evaluation form is designed for this purpose. The form will allow you to do a self-evaluation of your management leadership, worker participation, hazard identification and assessment, hazard prevention and control, education and training, program evaluation and improvement, and last, the communication and coordination of host employers, contractors, and staffing agencies. As part of the monitoring process, the primary Sept consultant will review your self-evaluation report before you move into the end stage. The benefits of improving your safety and health system, guided by the MCP, will provide an organization with a multitude of benefits. Employee morale and engagement will increase. You will be able to see that in measurable metrics in your HR department by seeing a reduction in absenteeism and a lower turnover rate. Investing in a solid safety program has also shown measurable increases to production and quality. Higher productivity, greater efficiency, lower scrap, and increased product quality will likely be observed as you continue to drive down your incident rates and property damage costs. Although traditionally safety was considered a business cost, it absolutely has the power to be a profit center for your company. On average, for every $1 you spend on safety and health improvements, you should see an approximate $4 return on your investment. Other benefits may include gaining more positive public image from your community, being able to recruit and retain desirable employees, increase your potential to obtain contracts because you are investing more money in your production and quality improvements and less in your workman's compensation and property losses. By agreeing to the MCP, you will have a free consultative service on a routine basis with your MIOSHA Sept representative. The program also offers a 6-month deferral from programmed inspections from the MIOSHA Enforcement Division, and it builds a collaborative relationship with MIOSHA overall. We understand that time is money, but by investing your time in this program, you will be able to take advantage of the immense benefits. Time is only one of the investments we require. The biggest investment needs to be provided from your top management through communication of the organization's commitment to safety and health improvements. This may be shown through policy and program changes, goal and objective accountability systems, and adequate resources provided for a successful change. Top management commitment is shown through time, money, and communication efforts. Success in the Michigan Challenge program starts with your commitment to see the program through. The Challenge program is not new. At least 5 states have participated in the Challenge program in the past, and there have been 27 successful graduates from different general industry organizations across the nation. By clicking on the Success Stories link from this page, you can read their full testimonials. By following the link in the previous slide to the OSHA Challenge Success Stories page, you will be able to read full testimonials from these organizations. Here are just some of the positive things these companies had to say about the program. One company had a reduced TCIR from 5.12 to 1.29 by emphasizing situational awareness, hazard recognition and reporting, management leadership, and employee involvement. Another company said that key collaboration helps achieve safety milestones. In approximately 2 years, we have seen an 84% reduction in our injury rate, which is now well below the industry standard. Team mentality proves beneficial in establishing strong safety cultures. Another organization said that the increased employee involvement leads to many positive results. Beyond experiencing financial benefits, challenge participants also reported increasing employee morale and ownership of the site's safety and health management system, or SHMS. For example, employees have become more involved in leading critical aspects of the SHMS, including conducting self-inspections and accident investigations, or suggesting improvements to specific safety policies. By empowering them with the necessary tools and knowledge, they have been the real champions and beneficiaries of the company's success and have continued to quote-unquote challenge their own safety performance with successful results. We would like you to have a successful experience with the Michigan Challenge program. You can begin today by offering your interest in applying. You can do that by telephone, by calling the Consultation, Education, and Training Division's main number at 517-284-7720 and let our support staff know that you are interested in the Challenge program. You can also reach the MIOSHA consultant for your area by going to our website at michigan.gov/MIOSHA/request for consultative assistance and fill out the form. You will be put in contact with your local consultant within 3 to 5 business days. If you have any questions or want to have a discussion with any of the presenters or the facilitator for this program, we will be available in the chat function for the rest of our time period today. You can also contact the Michigan Challenge Program Facilitator, Barrington Carr, at 517-284-7730, or by email at carrb, C-A-R-R-B, @michigan.gov. Your presenters today, Chris Johnson and Deb Zeal, are also available. Our phone numbers are available on this slide, as well as our email addresses. Feel free to contact us with any questions that you may have now or in the future. Thank you for participating in our webinar today, and we hope to hear from you soon.